and our 14 by 17. Okay. Where are we centering for this projection? Mid-neck, and at what level? C6, C7. How do you find that?
In the instruction.
What is that?
No, sorry.
Okay, so C6, C7. You already know how to find C7, don't you?
Yes.
Okay. So look for that vertebral prominence. Going to be right about that level. Okay, step as close as you can, shoulder against the floor. I'm going to come down just a tiny bit. All right, step forwards. Okay, good, nice and straight. Good, nice and straight. Okay, so our goal here with the soft tissue neck is to be right here in the middle of the neck. Okay, we're going to take our collimation, we're going to bring it down, okay, to the ear here, right? We want to be right here at the EAM, the opening of the ear, your external auditory meatus. Okay, we're going to lift the patient's chin up slightly. Okay, good. So this should also line up with like the bottom of the nose here. We are going to collimate in horizontally. Okay. Our goal is to catch the soft tissue in the front part of the neck. The spine right now is not our primary concern. We want to look at trachea and esophagus. Okay. For this, we do need a true lateral, so I'm going to have you turn your head just a tiny bit to the left. Okay. Okay. And then take half of that and go back towards the right. Good. Okay, so you want to make sure that the patient is in a true lateral. So shoulders are lateral, and that the head is also lateral. You don't want rotation, you don't want tilt. You want to make sure that the neck is nice and straight.
When we take a chain to the real patient, we do the same thing, like two hand, like figure out the.
Yeah. So if you want, you can tell the patient, "I'm going to move your head for you." Okay, you can rotate their head yourself personally. Me, I prefer to touch the patient as little as possible, so I'll do that to kind of check my centering, and then I'll tell them how I need them to move. And then finally, if the patient's uncooperative, that's when I'll actually step in and move them myself. Okay, but in my opinion, the mark of a good X-ray tech is one that can talk their patient into position. If you can talk your patient into position without touching them a single time, you are a master at your craft. That is my opinion, okay? You won't find it in Bontrager's. You are not going to find that in the test question, but that is just my personal opinion. So, center here, C6, C7, center here, middle of the neck, MCP, collimate in, make sure you still have trachea, make sure you still have esophagus. Okay, right here, top of the ear, down to the shoulder. And now, marker. Which marker are we using? Why are we using the left marker? Good. Side closest to the IR. Will we put this marker AP or PA? Why are we putting it AP? Because we're lateral. We always put a marker AP on the lateral. So here we have left marker AP. Okay, what is our final step? Breathing instructions. How are the breathing instructions different this time?
Take a deep breath, and after breathing, do the X-ray to capture the air.
Good. So you want them to breathe in. When there's air in the trachea, you want to expose. Okay. So take a deep breath in, expose, and breathe normally. All right. Does that make sense?
This time one time only? One time?
One time. So the reason we do 2 breaths is to expand the lung fields.
Okay.
Right now, we're not looking at the lungs. So we just need to 1 inspiration, X-ray while there's air in the trachea.
And the both people were always